We've invited Dr. Eliza Holland, a pediatrician at the University of Virginia Health Center, to answer some more questions. Dr. Holland, thank you very much for joining us.
Thank you for having me.
So should we be more concerned about RSV than COVID and the flu, or is there a hierarchy of these three?
RSV is a seasonal virus that pediatricians are well versed in. And yes, RSV in younger children is definitely more serious than COVID. The children come in, they often have a hard time breathing, they're not drinking well, they may need supplemental oxygen. Children who have COVID, for the most part, have mild symptoms and often do not need to be hospitalized. I think it's important to remember that most hospital systems are testing all children right now for COVID, RSV, and flu when they come into the hospital. And so often COVID is an incidental finding, and it's not what's actually bringing them into the hospital.
That is interesting. Now, we have seen different reactions to COVID across the country, a lot of times because local and state governments have different policies. But we still have differences in flu and RSV in different parts of the country, and it's certainly not based on any sort of politics or state and local regulations, or at least not as far as I can see. But what would cause the difference in somebody, perhaps in Washington State, more RSV or less versus somebody in, say, Mississippi?
Some of it is seasonal variation. Influenza tends to be in the South more during the summer months or the warmer months, and then moves north in the colder months. It depends on what your local immunity is, probably flu, also with your flu uptake. Rural areas tend to have a little bit lower incidence of flu shot uptake. And some of it is just luck.
Luck. That's not what parents want to hear, but I understand that is kind of what happens sometimes. Now, I have a soon-to-be 15-month-old child. When should I take him to the hospital? What are the signs where I'm looking for where he's sick, we can watch it, we can take him to the doctor, we can wait for an appointment, versus he needs to go to the hospital right now?
That's a great question. So RSV, which is what's on everybody's mind right now, starts off as a cold in most children. So you're going to see some runny nose, some cough. It usually gets worse around day 3 to 5, and the children may have increased work of breathing and difficulty eating. So what you're really looking for as a parent is, does your child feel well enough to drink and stay hydrated? Are they breathing faster than normal? When they're breathing, can you see their ribs? Is their nose flaring? Do they look blue around the lips? That would be an emergency and something that you would want to have your child seen for. So it's important to remember that almost all children see RSV at least once by the time that they are 2. So we haven't seen it over the past couple of years. And we are seeing children who are older coming in with bad RSV. So kids who are 3 or 4 who maybe would have seen RSV by the time they were 1 or 2, there just wasn't that much RSV over the past couple of years. So now we're seeing younger children getting sick and some older toddlers. But this is a virus that comes around almost every single year. And so children will get it over and over again. The good news is, even if it's bad the first year, the second time you see it, the third time you see it, the children are bigger, they have a better immune response to it. So even if your child gets really sick this first year, don't worry that that's going to happen every single winter.
All right, that is some great information for us. Dr. Eliza Holland from the University of Virginia, thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.